coracoid process. There's another muscle that comes, there's another two muscles that come off the coracoid process in the arm. Let's look at that. So here, this is the deltoid. On the human, we have one deltoid with anterior, middle, and posterior fibers. On the cat, it's broken down into a spinal deltoid, a chromodeltoid, and a clavodeltoid. So it's got three parts of the deltoid, but they have three separate names on the cat. And then, so when you take that deltoid off, and now we can see something, and you see this coming up in here on the inside of the arm, and this right here. What is this muscle? That's the biceps brachii. It has two heads, right? One of them's a long head, and one of them's a short head. Which one is the long head? Which one would you think? It's deceiving.
This one?
Yeah, because I said deceiving. See, this looks longer, right? But notice it's coming off the coracoid process, right? But if you went up, you remember, if you look at the picture on the board over there, I drew that circle. That's the glenoid cavity. And at the very top of the glenoid cavity at 12 o'clock, remember I taught you that supraglenoid tubercle? This is kind of important. That's where the long head of the biceps actually is going up and wrapping all the way up inside deep. You can't see it. And it's going through a groove. Remember the groove or the sulcus? What was that groove or sulcus on the last exam? Remember that groove on the humerus, the sulcus? In between? Intertubercular sulcus, right? So the long head tendon of the long head goes through that groove, wraps all the way up the top, and goes on to the supraglenoid tubercle. So it's longer. It just doesn't look it here because it's going underneath the muscle here, right? You know, I did the push button test on Mom the other day. My mom came in with shoulder pain. She could lift, 86 years old. And push button test. It's a very simple test. You just press right over that area. It causes pain and swell. You feel the swelling and this pain. They probably have bursitis and tendonitis, bicipital tendonitis. Now the bursa, what is a bursa? Basically what a bursa is like a little fatty pillow. Imagine if you were going to make a pillow out of fat. You have to sew a membrane around it. Right? So you have a synovial membrane filled with fat and fluid. And so there's a bursa here too, in between, because a lot of muscles are going to be coming across here, and so on and so forth. The pec major is going to come across. Notice the pec major comes across here and is underneath that. And you're seeing it come across here. I'm sorry, coming across. It goes, and underneath that would be the bicipital tendon. So you have a bursa there. So people can have bursitis and tendonitis at the same time. When someone says, I have tendonitis, they say it like it's the end of the world, like it's a diagnosis disease and that's it. Or they say they have bursitis. Why is it? Because there's some sort of mechanical disadvantage causing that, and you have to find out what caused it, rather than just treat the symptoms, right? So again, this is your biceps, two heads, biceps brachii, two. You have this long head going through the intertubercular sulcus. The short head goes to what? Coracoid process. Look at this other muscle coming off on the inside of the arm. This little skinny guy. Say it again? Coracobrachialis. That's inside the arm, up in here. It's coming off the coracoid process. A little unique. It has a nerve that pierces it called the musculocutaneous nerve. And sometimes that muscle gets tight and causes tingling and numbness in the hand and arm. It's very diffuse all across the surface because it's a cutaneous nerve that's coming deep from the deep level, piercing through, supplies that muscle too, and then it comes down and supplies the skin on top. So there's an effect with sometimes with that muscle being tight. So biceps brachii, if you lift it up and look underneath, what do we got? The brachialis. What other muscles similar to that? Remember the leg? Last week we did the quadriceps. So when you look at the quadriceps, here's the anterior, this is the left leg, right? Patella ligament. Here's the rectus femoris going down the middle. You know it's a rectus because why? Sure. It's got that pennate shape, right? Vastus what? Medialis. Vastus what?
Laris.
Where's the intermedius?
In the middle.
Underneath, right? So the vastus intermedius is underneath. Right? So you have the quadriceps, so they're in the leg, right? Just so you see the similarities, you know, you see like a pattern occurring here, where you have this main muscle down the middle, and underneath there's another muscle underneath it, right? So you have vastus medialis, vastus lateralis, vastus intermedius is underneath, right on the bone. And so with the biceps, we have the biceps brachii, short head, long head, and then the brachialis underneath. Okay? And now in the pictures, sometimes the picture makes it look like it's lateral, right? But it's really underneath it. See? Or lateral medial. This is the biceps. This is the brachialis. This is the brachialis. There, you see that? It's really underneath, right? And it's only going this high. And it goes across the arm. Right? So one of the things about the long head of the bicep that makes it unique is that it crosses the shoulder joint. See that? So not only does it go across the elbow and the forearm and flex the elbow at the forearm, right? It also can flex the arm at the shoulder, too. The long head of the biceps can do that, too. So if you ever had a personal trainer or see somebody with a personal trainer and they said, come on, let's do curls, let's get the peak, come on, go up, get that peak, right? So you curl the arm this way, and then you go up and you get the peak of the bicep, because now you're contracting it fully, right? You're getting the full contraction of it. And then on the back, remember last week we pinched an inch? You pinch in between here, right? Did I do that with somebody last week? Probably. Maybe I didn't do it this class. I did the other class. Did it with somebody. I grab here, and we see that latissimus dorsi, right? Coming from the bottom, goes underneath, and then there's a muscle that follows with it. What's that muscle? What's the little brother of the latissimus dorsi?
Teres
Major.
Teres major. So that one is not part of the rotator cuff because it's going with the latissimus dorsi and doing the opposite that the rotator cuff would do. And then you have your rotator cuff muscles underneath the trap to see it better. So you pull the trap off, this is the trapezius muscle, and then you see your rhomboids in between, and then your muscles of the rotator cuff. This is your supraspinatus above the spine. This is your infraspinatus below the spine, and this is what? Teres minor. Then this would be?
Teres major.
And then this would be what? The long head of the triceps. Very good. So that's my point. Now we pinched here, right, and the lats was on top. The lats were on top of that. This is the long head of the tricep coming in between the two muscles. You see that? That's your long head of the tricep. That one goes all the way up to the scapula as well, and it inserts at 6 o'clock on the glenoid cavity, at the infraglenoid tubercle. Remember? You had a notch at the top of the glenoid cavity at 12 o'clock. And you had a little nodule at the bottom at 6 o'clock. The nodule or the tubercle on the bottom is called the infraglenoid tubercle, and that's for the long head of the tricep. What's this muscle again?
Major.
Teres major, right? And the lats are removed, right? So that's this right here. Here's your teres major, here's your lats, teres major, here's your teres major without the lat, right? This is teres minor, infraspinatus, supraspinatus. Let's look on this one. Teres minor, infraspinatus, supraspinatus. See that? Okay. So looking at the triceps, here's that long head of the triceps. This is the lateral head of the triceps, and this is the medial head of the tricep.
Okay, do that again, please.
Long head of the tricep. This is the left arm, right? Long head is in the back, lateral, and then medial is right here.
Okay.
3 heads of the tricep. What's this one?
The brachial.
Very good, brachialis, right? What's this one?
Bicep brachial.
What's this one?
Long.
This one?
Short.
What's this one?
The corpus brachial.
Hoorah. What's this underneath? Subscapularis. Awesome. Very good. You guys picked that up really quick. Now, let's look at the muscles that flex the forearm, right? And on the flexor side, they all start from the medial epicondyle. And on the flexor side, and the way I do it is try to memorize it visually, you know, and in order. And there's one weird one right here. See that one? That one doesn't go all the way down to the wrist, does it? So these are flexors of the forearm and also flexors, these are flexors of the wrist, excuse me. These are flexors of the wrist. The biceps brachii was a flexor of the forearm. Flexors of the wrist. But this one is not. So I want somebody, put your hands out. Okay? Now you put them on top of mine. You put them the other way, like that. Ready? Come on.
Oh, you want me to, what am I doing?
Keep me from doing that, yeah. Okay, so what am I doing when I do this?
You.
Pronating my
Yeah.
forearm, right?
Mm-hmm.
Okay? So when you pronate the forearm, the pronated teres is the thing that does that. So here it is. That's the pronated teres.
Okay.
See that? This is a unique muscle. It's unique because there's a nerve that passes through this muscle. It actually goes in between the fibers. There's superficial and deep fibers, and the muscle pinches it sometimes. That's the median nerve that triggers the carpal tunnel symptoms. So if you have a spasm or tightness of the pronated teres, it could give you the symptoms of carpal tunnel. And actually, there's a syndrome called pronated teres syndrome. You don't need to know that for a test, but sometimes it makes it come alive when you really think about this muscle, right? You know, someone has some symptoms of carpal tunnel, and I do this on my patients. Let's say you had carpal tunnel syndrome. One of the things I'm checking right away, I feel for that muscle. Is there any spasm in that muscle? To see if that might be one of the triggers of it. Okay, then we come down. Now we have an order of several muscles here. And this one is more lateral, right? This is the left hand, right? So we're on the lateral side. And it's going to the radial side, right? So this is a flexor. Goes to the carpal region. Flexor, carpi, radialis. On the opposite side, there's a flexor, carpi, ulnaris. Going right down the middle on the top, notice it's cut here. See that? This is a unique muscle. It's called the palmaris longus, and it wrinkles the palm. See that? See that top one? That's number 20, what is that, 24? And notice this thing going across here, see that white fiber? That's a retinaculum. A retinaculum is kind of like a ligament that holds everything together in the wrist. That's a pretty superficial one. Then there's a deeper one. There's like 2 retinaculums there. This is on top of the retinaculum, so this is the skin, right? This would be deeper. That's one way of looking. So you feel when you're looking at an exam, take your finger down, palpate it down, you feel the edge of it. It's on top. That's got to be the palmaris, right? You know, when they do carpal tunnel surgery, that's all they do is they snip the retinaculum here and deeper to release the pressure where the median nerve is passing through underneath. So it takes about all of like 5 minutes for them to do that aspect of the surgery. Boom, boom, it's done. Actually, it could take them a minute. That's how fast they can do it. But I'm sure the prep time and the post time is a lot bigger than that. So here is your, so what was this one? Pronated teres. Flexor carpi radialis.
Ulnaris.
And on top? And now this one right below. See that one? Now, it seems deep, but it's really, there's another one deeper than that. So we call this one, or we call, the anatomists call this one, the flexor digitorum superficialis. You have to say it like that. Did you ever watch Mary Poppins? You know,
No.
supercalifragilisticexpialidocious, even though the sound of it may sound atrocious. Flexor digitorum superficialis. Flexor digitorum superficialis. And why do we say it like that? Because if you go deep, there is a profoundly deep one called the flexor digitorum profundus, which is not on your list.
Okay.
You don't need to know that on the list. But that's why they call that superficialis. Because to me,